I like to think of it a little bit like a pacemaker, kind of like a heart pacemaker, but for your brain. It's a device that includes electrodes that are placed into very precise targets in the brain, which are connected then all under the skin to a little stimulator, which contains a battery and electronics, and it allows one to deliver electrical stimulation to the brain in a way that is designed to actually modulate or influence the way the brain functions and try to stop seizures from happening.
Are there specific targets you go for in the brain?
There are. The targets for epilepsy are in the thalamus, which is really arguably the deepest part of the brain. So we do have to very precisely hit very small areas, and we use very sophisticated intraoperative targeting systems to make sure that we get them safely in the right place so that we avoid complications, but also, importantly, get the most benefit possible out of the treatment. Responsive neurostimulation is actually a fairly new treatment, and it's another treatment similar to a pacemaker for the brain, where electrodes are implanted on the brain and connected to a device which includes some electronics and a battery implanted actually on the skull in this case. And it's a device that has some unique capabilities. It can actually record from the brain and transmit that information wirelessly to our neurology colleagues. And it actually is able to understand that and deliver a therapeutic stimulation in response to what it records when programmed to do so by us as clinicians. RNS is usually a therapy that can improve seizures meaningfully, but may not eliminate them completely. And typically, it's seizures that are arising from one or more specific focuses in the brain or foci that maybe are not ones we can remove safely. Maybe they're involved in moving your hand or involved in your eyesight or things like this that we want to protect.